The following presentation will provide a detailed proposal for a comprehensive school-based mental health program with the goal of enhancing students' well-being through equitable access to comprehensive mental health services and promoting resilience through targeted interventions. Program proposal components include the nature of the problem and program rationale, target population, logic model used for planning, specific goals and objectives, projective outcomes, evaluation processes, both formative and summative, proposed budget, potential funding sources, and program implications for policy and practice. The target population for the proposed program is public school students in rural Texas schools. Economically, rural Texas schools face high rates of student poverty, with a substantial percentage of students qualifying for free or reduced price lunches. Additionally, a significant number of uninsured students in the United States face substantial barriers to receiving mental health care, which leaves critical needs unmet and contributes to long-term challenges for these youth. Research shows that students without health insurance are far less likely to access mental health services, with close to 90% of uninsured children and adolescents who need mental health care support receiving no care at all. The lack of insurance limits access to providers, reduces the likelihood of early intervention, and may contribute to a greater reliance on emergency services when issues become critical. Furthermore, geographic challenges create significant barriers for rural Texas students. Geographic isolation affects the availability of mental health resources, and attracting and retaining mental health professionals is more challenging in these rural areas, contributing to the lack of available mental health care for rural families and students. Long distances to reach mental health services place a significant burden on low-income families who may lack reliable transportation and often face the added challenge of missing essential work hours to attend appointments. When considering mental health resources within a school setting, there are numerous statistics and studies that support the need for increased access to mental health support for youth. Approximately 1 in 5 U.S. children ages 3 to 17 experience mental, emotional, developmental, or behavioral challenges. The most recent Youth Risk Behavior Survey revealed that 42% of high school students experienced prolonged feelings of sadness or hopelessness affecting their daily activities. Studies indicate that nearly 80% of children ages 6 to 17 who need mental health care do not receive it, with an even higher percentage among uninsured youth. Significant barriers to accessing mental health care exist, especially within marginalized communities where obstacles like stigma, limited mental health awareness, and scarce resources such as transportation, insurance, and affordability prevent many from receiving needed support. Schools offer a unique setting where students' social, emotional, and mental health needs can be identified early, allowing trained staff, such as school counselors, licensed professional counselors, and licensed specialists in school psychology, to provide targeted interventions before issues escalate. Incorporating mental health professionals into school environments can significantly improve access to care, facilitate timely interventions, and enhance overall student outcomes. By having these specialists on site, schools can address mental health concerns more proactively and ensure that students receive the support they need when they need it most. The logic model was used to strategically plan the proposed school-based mental health program. Aligning the multi-tiered systems of support, or MTSS framework, that is currently being utilized in public schools for academics and behavior, the proposed program would offer 3 tiers of services based on need. Tier 1 would provide universal mental health support that would benefit all students. Inputs for this tier include the use of universal mental health screeners, school-wide social emotional learning and mental health literacy curriculum, staffing, and funding. In Tier 1, all students would participate in mental health education and awareness activities and initiatives. Additionally, to support these efforts, all staff would be trained in recognizing signs of mental health concerns, utilizing the evidence-based program Youth Mental Health First Aid. The expected outcomes include increased awareness and mental health literacy among staff and students, reduced stigma, and reduced office discipline referrals. The expected outcomes include improved overall well-being, evidenced by self-report on surveys and repeated administration of the mental health screener, as well as improved attendance and decreased prevalence of mental health concerns among students. Tier 2 services would focus on targeted interventions for students identified as at risk according to the mental health screener results. This tier would require trained counselors and/or behavioral specialists, small group intervention curriculum and materials, as well as a meeting space and allotted time within the student's schedule. Small group intervention focused on specific concerns and behavioral issues would be provided according to a schedule, along with frequent scheduled check-ins, at least weekly. The desired outcomes for this tier of services include reduced office discipline referrals, increased attendance, and improved coping skills among at-risk students. Potential impact would be improved relationships with peers and adults and improved coping skills as evidenced by increased time in class and reduced classroom disruptions, resulting in overall improved school culture. Finally, Tier 3 focuses on students with intense needs identified by the mental health screener or history or presence of mental health crises. This tier would require licensed mental health professionals, community-based partnerships, individual therapy resources, designated meeting space for confidentiality, and allotted time for individual therapy and services. This tier would include one-on-one counseling with a licensed mental health professional, crisis prevention and intervention as needed, family engagement, parent training, and coordination with external mental health services as needed. The desired outcome of this tier includes stabilization of students with intensive mental health needs, reduced number of crisis incidents, reduced number of behavioral threat assessments, and reduced number of hospitalizations. The potential impact includes reduced dropout rates, reduced number of repeated hospitalizations, improved school connectedness, and improved academic performance. Through strategic planning and staffing, a multi-tiered mental health program could greatly benefit students through early intervention and access to consistent mental health support, leading to improved outcomes in all areas. The mission of the school-based mental health program is to foster a supportive and nurturing environment that promotes the emotional well-being of all students and staff. Through early intervention, targeted support, and a commitment to creating a positive school culture, our program aims to enhance emotional wellness and resilience among students and staff, strengthen school connectedness, and improve access to needed supports. In order to achieve this goal, specific outcome objectives and processes and activities have been identified. The first outcome objective reads, by May 20th, 2025, student mental health literacy, or knowledge and awareness of social emotional health, will increase by 50% as measured by a pre-post student survey data. This would be administered by the school counselor. Intermediate outcome 1.1 states that 80% of students will complete all mental health curriculum by May 1st, 2025, and this would be carried out by the school counselor and classroom teachers. Process objective 1.1-1 states that by September 1st, 2024, 100% of staff will be trained to administer the mental health literacy modules through base education, organized by the school counselor and base education consultant. Process objective 1.1-2 states that by September 15th, 24, all students will begin the base education modules during weekly tutoring time monitored by the classroom teachers. Finally, objective 1.1-3 states that by September 1st, 24, every student will be administered the mental health literacy pre-test during homeroom period. This would be organized by the school counselor and administered by the classroom teachers. The second identified outcome objective is to reduce the number of office discipline referrals by 25% as measured by monthly office discipline referrals entered in Skyward from August 20th, 2024 to May 20th, 2025. The assistant principal would be charged with monitoring this data. Process objectives and activities related to this outcome include Process Objective 2.1, which states by January 1st, 25, at least 75% of students with 2 or more discipline referrals will be included in weekly targeted intervention provided by a mental health counselor and/or behavior specialist specifically assigned to Tier 2 services. Objective 2.1-1 states that by October 1st, 24, 6-week coping skills curriculum will be finalized and adopted for use. This will be assigned to the mental health counselor and/or behavior specialist with approval by the principal. Objective 2.1-2 states that by October 1st, 24, an online referral form will be created and a shortcut will be placed on the desktop of the assistant principals to refer students with 2 or more discipline referrals to the targeted intervention groups the mental health counselor will be responsible for. The mental health counselor will be responsible for creating the form, and campus technology will be charged with installing the shortcut on applicable computers. Finally, Objective 2.1-3 states that by January 1st, 25, the mental health counselor and/or behavior specialist will create a schedule and pull any students with 2 or more discipline referrals for weekly coping skills groups utilizing the approved coping skills curriculum. The third identified outcome objective is to increase average attendance by 25% as measured by average daily attendance from August 20th, 24 to May 20th, 25. The PEAMS coordinator will be responsible for monitoring this data. Process objectives and activities related to this outcome include Objective 3.1, which states that the administrator will facilitate 4 parent engagement sessions focused on school connectedness and school community by May 1st, 2025. Objective 3.1-1 states that by October 1st, 24, 4 parent engagement sessions will be scheduled and put on the school website and school calendar to make parents aware. This will also be the responsibility of the school administrator. Objective 3.1-2 states that by October 1st, 24, all parent engagement sessions will be added to the school's social media pages to make parents aware. The school administrator will provide the information to campus technology, who will put the information on the school's social media pages. Finally, Objective 3.1-3 states that a pre-scheduled call out to parents and a parent email will go out 1 week prior to each parent engagement session to invite parents. Again, the school administrator will provide information to campus technology, who will ensure the call out goes out on schedule. The fourth identified outcome objective states that the number of mental health crisis events will decrease by 25% as measured by documented risk assessment reports from August 20th, 24 to May 20th, 25. This data will be monitored by the licensed mental health professional assigned specifically to Tier 3 services. There are 2 process objectives and multiple activities related to this outcome. Objective 4.1 states that by May 20th, 25, the licensed mental health professional, which we will refer to as the LPC, will provide referral and coordination services to at least 80% of students who have experienced a mental health crisis. Objective 4.1-1 states that by October 1st, 24, the LPC, in conjunction with the administrator and district social worker, will create a protocol for postvention services for students experiencing a mental health crisis. Objective 4.1-2 states that by October 1st, 24, the LPC and social worker will compile a list of vetted community resources. Objective 4.1-3 states that by November 1st, 24, the LPC and social worker will meet with a representative from the local mental health authority to clarify crisis response processes and outpatient services. The second outcome objective, 4.2, states that by May 20th, 25, the LPC, along with the administrator and social worker, will conduct re-entry conferences with at least 80% of students who have missed school due to a mental health crisis. Objective 4.2-1 states that by October 1st, 24, the LPC, in cooperation with the administrator, will create a protocol for re-entry conferences, including required committee members. Finally, Objective 4.2-2 states that by October 1st, 24, a re-entry conference form will be created and approved to aid in the creation of individual safety plans for students who have experienced a mental health crisis. This form will be created by the LPC and must be approved by the administrator. Broadly stated, the projected outcomes include the following. School-wide mental health education and awareness will be evidenced by increased student and staff understanding of mental health and its importance, and improved student ability to identify signs of mental health challenges in themselves or peers. Staff training on recognizing signs of mental health concerns will result in the enhanced ability of staff to identify and address early signs of mental health issues, increase staff confidence in providing initial support or referrals, and reduce delays in identifying and addressing mental health concerns in students. Small group intervention for at-risk students will result in improved peer interaction and problem-solving skills among participants, development of coping strategies specific to a group focus, and an enhanced sense of connection and belonging with the school environment. One-on-one counseling will improve emotional regulation and self-awareness in high-risk students, as well as the development of personalized coping mechanisms and problem-solving skills, and progress toward individual therapeutic goals, as well as crisis prevention and intervention services, reducing the frequency and severity of behavioral crises. The formative evaluation process for the school-based mental health program will involve collecting feedback from students, staff, and parents through surveys, mental health screeners, demographic data, and service completion data. Collecting data on coverage ensures that services reach the entire student body with Tier 1, and Tier 2 and Tier 3 services reach the intended population. Screeners and data collection ensure that students identified as needing targeted or intensive interventions are appropriately matched with staff to qualified to deliver those services. This tracking ensures that students receive the necessary level of support based on their specific needs and identified through screening process. Equity data helps identify and address disparities in access or outcomes among different demographic groups. Demographic data for students will also be collected to ensure that mental health services are accessible to all groups equitably and to identify any disparities in access or delivery of services. This formative evaluation will monitor on a per-student basis the number of services provided, the staff responsible for delivering those services, and basic case notes to document progress towards specific goals. These goals may include linkage to external resources, participation in group sessions, individual counseling sessions, or parent training sessions. Data collection will also account for the tier of services a student qualifies for, as determined by the universal screener, as well as whether they have experienced a mental health crisis. This detailed tracking ensures a comprehensive understanding of service delivery and student outcomes while tailoring support to individual needs. The summative evaluation for the school-based mental health program will measure its overall effectiveness by analyzing outcomes. Data from surveys, attendance records, and mental health screeners will be reviewed to determine the program's impact and guide decisions on its continuation or expansion. Results and impact data assess the program's success in improving students' mental health. Key examples of impact data include mid-year repeated screenings, surveys assessing mental health outcomes, and related indicators like attendance rates and office discipline referrals. This information provides a comprehensive view of the program's effectiveness and helps identify trends or areas needing improvement. By analyzing these data points, program administrators can make informed adjustments to enhance the program's efficiency, ensure services are equitably distributed among students, and optimize positive outcomes for all students. Additionally, data collection will focus on assessing the program's cost effectiveness by analyzing the total number of students served in relation to the annual implementation cost. This involves calculating the average cost per student and identifying variations in costs across service tiers, such as universal, targeted, or intensive interventions. Program administrators can determine whether the resources allocated yield measurable benefits by evaluating the financial investment relative to the outcomes achieved, such as reductions in mental health symptoms or improvements in school engagement. This information will guide decisions about resource allocation, identify areas where efficiency can be improved, and support justification for sustained or increased funding based on demonstrated value. Through this evaluation, stakeholders can ensure the program remains both impactful and financially responsible. Impact data address the most challenging evaluation question: what changes occurred for clients or students due to their participation in the program that would not have occurred without it? Various research designs can be used to evaluate program impact, but the single group pre-test post-test design is the most suitable for the school-based mental health program. Since equitable access to mental health services is essential, it would be unethical to withhold these services from some students for comparison purposes. To measure program impact, the Universal Screener will be administered at the start of the school year to establish a baseline, and then repeated mid-year and at the year's end. This approach ensures that all students benefit from the program while allowing for a meaningful evaluation of its effectiveness over time. Figure 2 below illustrates this experimental design. The proposed school-based mental health program budget is detailed on this slide. The program budget is divided among the 3 tiers of service: universal mental health interventions, targeted mental health interventions, and intensive mental health interventions, with cost allocated based on the total direct cost methodology. Many of the costs associated with the program are considered indirect costs because they benefit the entire student population, such as awareness campaigns, office space and supplies, and parent events. Universal mental health interventions, including salary for the school counselor responsible for those activities, curriculum, and staff training, account for approximately $105,000, ensuring all students benefit from proactive mental health education and prevention strategies. Targeted interventions, such as small group counseling and early intervention strategies, are allocated $92,000, reflecting the additional resources needed to address the needs of students at risk of developing more severe mental health challenges, and the salary for an additional counselor or behavior specialist assigned specifically to Tier 2 services. Intensive interventions, including one-on-one therapy sessions and crisis response services, require an additional $102,000, which is the salary for a licensed professional counselor assigned specifically to Tier 3 service delivery and coordination, as well as curriculum and supplies for intensive parent training. The total direct cost methodology was chosen to allocate cost accurately by linking expenses to the specific services provided, ensuring a clear and transparent breakdown that aligns with program objectives and resource utilization, also reflecting the utilization of shared resources. This approach ensures that funding is distributed equitably across all levels of intervention, supporting a comprehensive and sustainable mental health program. The total cost for the proposed program, including indirect cost, is $651,820. The availability of funding will expand our reach, deepen our impact, and improve outcomes for more students. Identifying funding sources is critical to the sustainability of the program. Potential sources of funding for the proposed school-based mental health program include federal, state, and local grants, as well as private foundations and community partnerships. Federal funding options, such as grants through the Substance Abuse and Mental Health Services Administration, can provide substantial support for mental health initiatives in schools. Additionally, legislative funding from the recently passed House Bill 3 allocates funds for mental health training for staff. State-level programs like Project Aware, Advancing Wellness and Resilience in Education, through the SAMHSA, or Substance Abuse Mental Health Services Administration, offer funding to increase awareness of mental health issues and improve access to services for students. Local education agencies might also be able to allocate Title IV Part A funds from the Every Student Succeeds Act to promote student health and well-being. Additionally, private foundations such as the Kaiser Permanente Thriving Schools program or the Annie E. Casey Foundation often fund innovative mental health initiatives targeting youth. Additionally, Partnerships with local healthcare providers, the local mental health authority, businesses, or mental health organizations, such as the National Alliance for Mental Health, could also yield financial or in kind support, such as staffing or materials. Leveraging a combination of these resources will most likely be necessary to sustain the program and to expand its reach to meet the community's needs. The implications of this program extend beyond the immediate school community. At the policy level, its success could advocate for increased federal and state funding dedicated to mental health initiatives in educational settings, encouraging policymakers to prioritize mental health as integral to academic achievement rather than a reactive approach to school safety concerns. From a practice perspective, the program serves as a model for intentionally integrating mental health services into schools with funds specifically allocated to provide targeted and intensive mental health services with fidelity while continuing to emphasize collaboration between educators, counselors, and families to create a proactive and supportive system. Future research should explore the longitudinal impact of school based mental health programs on academic outcomes, mental health disparities, and community well being. Additionally, studies examining cost effectiveness and scalability could guide the expansion of similar programs nationwide, ensuring that all students, regardless of socioeconomic background, have access to mental health resources they need to thrive. The proposed school based mental health program addresses a critical need to support students' emotional well being, academic success, and overall development. By offering a tiered approach, universal mental health promotion, targeted interventions for at risk students, and intensive services for those with significant challenges, the program ensures comprehensive and equitable support for all students. If you would like more information regarding the research supporting this proposal, feel free to contact me.